All right, let's talk about something that affects millions and millions of people all over the world, clinical depression. What we're going to do here is really break down what it is, what's going on behind the scenes, and most importantly, how it's treated, all based on what we know from the science today. Okay, let's get into it.
I bet you've said this before. You walk out of a really sad movie and you say, wow, that was depressing. You're talking about a feeling, right? That temporary wave of sadness the movie made you feel. But you wouldn't say the movie was clinically depressing. And that's the thing. There is a huge difference between the two. So what is the real difference here? Well, on one side, you have everyday sadness. It's temporary. It's usually tied to something specific that happened. But on the other side, you have clinical depression, or what doctors call major depressive disorder. This is a serious medical condition. And the key thing that sets it apart is that it's persistent and it actually gets in the way of your day-to-day life. We're talking about work, sleep, and even just finding joy in things you used to love. So, how common are we talking? Well, way more than you might think. Over a lifetime, the chances of experiencing it are as high as 20% in women and 12% in men. That makes it one of the most common reasons people ever seek out mental health services. This is a serious condition, and it touches a huge part of our population. So that naturally leads to the big question, right? What causes this? The truth is, there's no single, simple answer. It's way more complicated than that. Instead, we understand it as a mix of different factors all coming together.
Research points to this perfect storm of factors. For sure, there's a genetic link. Get this, if you have a close family member with depression, your own risk is about 3 times higher. But our genes never tell the whole story. They interact with our brain's biology, the environment we live in, and even our own psychological makeup. All of these things weave together to create a person's risk.
Biologically speaking, a lot of the focus comes down to these things called neurotransmitters. The easiest way to think of them is as the brain's chemical messengers. They're absolutely crucial for regulating pretty much everything. Our mood, our sleep, our appetite, you name it.
Okay, so how does this whole messaging system actually work? It's pretty cool, actually. A signal basically zips down one brain cell, a neuron, and tells it to release these neurotransmitter messengers into the tiny gap between cells. Those messengers then float across and lock into the next neuron, passing the message along. When this whole process is working smoothly, our brain functions well. And that brings us to the 3 main players when we talk about depression: serotonin, norepinephrine, and dopamine. The leading idea, called the monoamine deficiency theory, basically suggests that at the root of depression is a shortage of one or more of these key chemical messengers. Okay, so with all that complex biology in the background, how does a doctor actually figure out if someone has clinical depression? Well, it's not a guess. It's a very careful process based on a specific set of criteria from the official diagnostic guide, the DSM-5. This helps them build a really clear picture. And it all starts with this number, 5. To get a diagnosis of major depressive disorder, a person has to be experiencing at least 5 specific symptoms out of a list of 9. And not just once in a while. We're talking most of the day, nearly every single day for at least 2 weeks. So what are those 9 symptoms? They include things like a constantly depressed mood, losing interest or pleasure in things, major changes in weight or sleep, feeling exhausted all the time, feelings of worthlessness, and trouble concentrating. And here's the rule. At least one of those 5 symptoms has to be either that depressed mood or the loss of interest. But wait, it's not just about checking boxes. The doctor also has to make sure that these symptoms aren't being caused by something else, like a medication or another medical issue. They also have to rule out other disorders to make sure the diagnosis is accurate. Something that's really important to get is that depression isn't this one monolithic thing. It's not one size fits all. Major depressive disorder can show up in different ways, and clinicians call these different flavors subtypes. One subtype you may have heard of is depression with peripartum onset. It used to be called postpartum depression, but the name was updated because it can actually start during the pregnancy, not just in the 4 weeks after birth. It's often tied to big hormonal shifts, but the huge lifestyle change is also a major factor, which helps explain why it can affect fathers too. Okay, now this is really interesting. Let's compare 2 subtypes that are almost like mirror images of each other, atypical and melancholic depression. The biggest difference is this thing called mood reactivity. In atypical depression, if something good happens, a person's mood might actually lift for a little while. But with melancholic depression, it doesn't budge. And you can see how they have opposite effects on appetite and sleep too. And then we have something called persistent depressive disorder, which you might also hear called dysthymia.
This is more of a chronic, simmering form of depression. The symptoms are often milder, but the defining feature is how long they stick around. For a diagnosis, they have to be present for at least 2 years.
All right, we've talked a lot about what depression is, how it works, and how it's diagnosed. But now we get to the most important part of this whole conversation, getting better. And the most important word here is hope.
Let's just start with the headline here. The most important thing you need to hear. Treatment works. It really, really works. With the right plan, somewhere between 70 and 80% of people with clinical depression can see a huge reduction in their symptoms. There is absolutely a path forward.
So what does that treatment path actually look like? Well, it usually breaks down into 2 main categories. You have approaches that don't involve medication, and then you have ones that do. And very often, they work best when used together. First up, you've got approaches that don't involve medication. Psychotherapy or talk therapy is a real cornerstone, especially for milder cases. But you know what else has a proven impact? Lifestyle changes. The data shows that even just 20 minutes of exercise 3 times a week can help, as can focusing on healthy eating. Now, for more moderate to severe cases, medication can be an absolute game changer. The most common type are called SSRIs. And let's connect this all the way back to the beginning. Remember how we talked about those neurotransmitter messengers being released and then reabsorbed? Well, SSRIs work by blocking that reabsorption or reuptake of serotonin. This leaves more of it hanging around in the brain to do its job and pass on messages. But beyond all the therapy and medication, there's one more thing that is just incredibly powerful. Sadly, there's often a stigma around depression that can make people isolate themselves and feel even worse. And that's exactly why a strong support system is so vital. The love and support from friends and family, it's been shown to make a huge difference in recovery. It reminds us all that nobody has to go through this alone.